Fundamentally, the Affordable Care Act is very good. Right now, already, as of this month, there are 8 or more million Americans who have health care coverage, who have insurance companies paying better attention to them, who, for example, there are many millions of people who are now eligible for Medicaid and receiving Medicaid coverage that were not a year ago. You're in New Jersey, a year ago, if you were very poor and childless, you were out of luck if you were under age 65. If you were 65, you had Medicare. That's great. Medicare works. I don't know anybody on Medicare who thinks it doesn't work. And now, because Governor Christie agreed to go into the federal program, there are hundreds of thousands of New Jerseyans now eligible and covered by Medicaid. There are tens of thousands of New Jerseyans who are 24, 25, 23, who are on their parents' policy and have health care coverage that they did not have before. There are across the country millions of women who cannot be discriminated against as they were up until this year. In other words, they cannot get inferior coverage just because the insurance company wants to give them inferior coverage. Preventive care is now covered. And on Medicare, you can see your doctor once a year for an appointment that has nothing to do with a diagnosed ailment. Previously, you couldn't do that, or you could do it, but the doctor wouldn't be paid, so he wasn't going to schedule it, or she wasn't. Prescription medicine costs for people on Medicare is coming down and will be coming down more. Everyone is now getting, or is now eligible, whether they are going through the Affordable Care exchanges, or whether they have a policy through their employer, or they're self-employed and have a policy, they are getting better preventive coverage than they were a year ago. You cannot be discriminated against because of an existing ailment. I take this kind of personally. My sister, I believe, I'm sure, died early because she did not have insurance. That's repeated millions of times around this country. This Affordable Care Act will bring tens of millions of people. So far, not yet 10 million, but it's growing. Soon we will be at that 10 million number with millions, tens of millions more to follow, who will have coverage because of this law. Those people, those 100 million or hundreds of millions of people who already had health care coverage through their employer or otherwise, will have insurance companies paying more attention to them. Under this law, an insurance company must spend at least 80% of every premium dollar on giving you health care. Now, 80% doesn't sound like a lot, but a year ago, it was less than that, or 2 years ago. No, it was less than that. On average, insurance companies were not spending even 80% of your premium dollar providing you health care. Now they must. So I could go on and on about what is already in effect, what is helping. You were asking what changes need to be made. You said fundamentally. I would say fundamentally what we should do is move as rapidly as possible toward universal, single-payer Medicare for all. That would be more efficient. It would provide better care. It would save money, and it would improve the quality of care. With regard to two of those points, the Affordable Care Act does make real progress. Improving the quality of care. With the Affordable Care Act, we are moving from, we have not yet fully moved from, but we are moving from payment by quantity of procedures and tests to the quality of the outcome. And of course, that's where we want to go. Nobody wants healthcare in America to be determined by the number of tests, the number of procedures ordered and paid for. What we want is quality outcome. Right now, the quality outcome in the United States of America is not what we would want. We are far and away the most expensive. We spend more on healthcare in America than anybody else. And the quality of the outcome is mediocre. It's not terrible, but it is far from the best in the world, except for some people. And this is going to make healthcare in America much more equitable. And as for saving costs, which I do think Medicare for all or some kind of single-payer universal coverage would, the Affordable Care Act actually is saving money. Now, the other party in Congress, and it is entirely the other party, I'm not trying to make this partisan, but it is clear, the Republicans have said their number one goal is to repeal Obamacare. You've heard that, I'm not making that up. If they did, it would increase the debt of the United States of America by $1.6 trillion. How can that be? How can we bring more people into the system and yet save money? Well, several ways. The outcomes will be better. It will be more, healthcare will be delivered more efficiently. People who come into the system will, in part, be paying for it, with, of course, government subsidies, but also because money was raised. Yes, taxes. The Affordable Care Act includes some taxes. The money raised far exceeds by $1.6 trillion over the next 20 years the cost of the program. So you can repeal it, but it'll be costly. Costly in actual dollars to our debt and costly to the health of Americans.